So, a 46-year-old lady presented to the clinic with basically a wellness visit. So, this lady, after presentation, I started asking her general question: How was your health in the previous year? And all of these questions. So, basically, her last visit was 1 year ago. What was interesting about this lady that when we reached for the review of the systems, I was asking her, well, do you have this? Do you have that? Do you have this? Do you have that? Until I reach a moment when I ask her, well, can you tell me, do you have um, constipation or diarrhea? So she said, well, oh, no, not really. I was like, well, wait a second. Why she is so hesitant about it? It's like, no, just tell me. If you have something, we can work on it and we can fix it. So for her, she did have something, but she was kind of embarrassed to admit it. In the end, she was like, yeah, I do have something. So I was like, what is it? She was like, constipation. I was like, okay, good. How bad is the constipation? She said, basically, this constipation has been for the previous 3 years. By the way, this is just a 5 minutes video. Um, for the previous 3 years. So I was like, okay, well, do you have any combined symptoms, abdominal pain, anything like that? She said, well, not really. I was like, is it painful? She was like, well, I'm not sure. I was like, really, just don't be embarrassed. We see a lot, and you always need to comfort the patient because sometimes they are just too embarrassed to admit their illness and they suffer in silence, basically. So she said, well, yeah, I do have pain with it. I was like, is there any blood? She was like, sometimes there is a minor spotting on the basically toilet paper. Like, okay, fine. So I requested the nurse to come. I did some physical examination, and this lady had something known as basically anal tag, in which you can, people with anal fissure around basically the sphincter, you will be able to see um, a piece of like a lesion. And that lesion basically tells you that there was a persistent process of repair occurring. So after physical examination, it was obvious that she does have anal fissure. It was the anal sphincter was super tender. It was closing, and it was tightly closing, which is a sign of pain, basically, in the patient. Um, she used to go to the bathroom once every 3 days. So why the constipation, though? How is anal fissure related with constipation? The idea is simple. When the patient has the pain, he is basically too afraid to go to the toilet. So when he goes to the toilet, the stool is so dried out. Basically, the colon function is to absorb water and minerals. So when the stool stays inside of the colon for a long period of time, it will get absorbed. After absorption of all of this fluid from the feces, it will become super solid. And when it exits the colon, it's going to injure the patient. So when the patient gets injured, he will bleed, basically. That's the spotting she was speaking about. And because of the injury, it will be so painful for the patient that next time he will be afraid to go to the toilet. So, which means longer period of constipation for the next time. And the next time, the stool will be even harder. And it enters an endless cycle of pain and bleeding. So, most likely area to have the anal fissure is basically the posterior, the behind area of the anal canal. The reason is because it has really poor blood supply. This is the main reason, which was in this case actually. So what I did for her, basically the treatment is pretty simple. There's first of all diet modification. Second, and this is where it becomes important, well, why this patient is not going to the bathroom? Because of pain. So what can we do for her? Well, the pain is caused because the sphincter is so close, the muscle is so tight. At the same time, it's painful. So, what I did for her, I gave her a cream in which it has basically a muscle relaxant activity. So, it relaxes the anal sphincter. And when she applies it, this anal sphincter will be relaxed and anesthetized in the same time. So, less pain, local anesthetic in it as well. So that will decrease the pain, first of all. So we excluded the pain from the equation. Increase her diet and give her some basically some form of laxatives, not really potent though, so she can keep going to the bathroom. Um, Basically, this idea of giving the myorelaxant and improving, basically modifying the diet and doing all of these things, our main idea is to decrease the pain, reduce the suffering, and improve the quality of life of the patient. Interestingly enough, most of these are reversible, completely healed. It's super rarely that these will actually require surgery. So they can be treated in a clinic. The only issue is to know that they exist in the first place. Because as I said, most patients are too shy, too embarrassed to admit that they have such disorder. So if you are the patient, don't be shy. Physicians have seen a lot, and it's fine for them. They don't really care. For them, it's mainly your health, what they care about, and you should not be shy from your physician. And if you are a physician, please do ask your patient about such issues that might be embarrassing for them. But if you treat them, they can provide a huge difference in this patient life. And that's it for our today medical case.